Addiction is like a deceitful whirlpool that lures you with promises of relief, euphoria, only to trap you in its relentless currents, pulling you deeper and deeper until escape seems impossible. Today, I have a crucial topic to address, one that affects countless lives in the community. We have the privilege to have a special guest with us, Ron Schnese, who is an expert in the field of mental health and substance abuse. Together, we will delve into the essential conversation, shedding light on the challenges individuals faces and the support they need to overcome these hurdles. For my Medicare segment, I'm going to discuss Medicare Supplement or Medigap. And for my Medicare Q&A or question and answer, I'm going to answer questions about Medicare Supplement or Medigap. Well, as we age, ensuring the safety and well-being of my senior or loved ones becomes paramount. Falls have emerged as the #1 cause of injury among seniors, leading you to fractures, hospitalization, and sometimes a decline of independence. Well, I have a short video that will give you or guide you on how to prevent a fall. Well, I have an exciting news, dear viewers. By making a difference, MariaCares, starting in August, will make a difference in California, reaching out to even more seniors with our valuable insights. Your unwavering support and trust have been the driving force behind my mission. Rest assured, I will continue bringing you essential information on health, Medicare, and everything that affects your well-being. Together, we will navigate the path to healthier and happier lives. Thank you for being a part of the MariaCares family. So, no matter what state you're from or what work you've done, you must transition to Medicare at a certain point in your life. MariaCares has a mission to bring Medicare information right to your home. I'm your host, Maria Garcia, a licensed sales agent, always available to assist you with your Medicare concerns. This program is broadcasting in the wonderful city of Las Vegas, the city you would like to be in, most especially when you retire. Just like me, you will surely love Vegas. So, come on, let's join hands to a better health. It is an honor to introduce Ron Schnese, the Community Outreach Specialist of the Foundation for Recovery, a truly remarkable organization dedicated to supporting individuals and families struggling with mental health and substance disorder use, led by volunteers and staff with lived experience with the community. Nonprofit focuses on strength, not illnesses, or they create a sense of belonging and support for those on their journey to recovery. Please join me in welcoming Ron Schnese, a compassionate advocate for building a resilient and empowered recovery community in Nevada. Hi, Ron.
Hi, Maria. Thank you for having me today.
Oh, it's a pleasure, Ron. So, Ron, please introduce yourself. Then I have some questions to ask you about the Foundation for Recovery.
Okay. Well, my name is Ron Schnese. I'm a person in long-term recovery, and what that means is I have not felt the need to put a mind or mood-altering substance such as drugs or alcohol into my body since December 24th, 2014. Nice. So, a little over 8 years.
Bless your heart.
Yeah, thank you.
So, Ron, can you share with us the mission and the vision of Foundation for Recovery and how it aims to support individuals and families struggling with mental health and substance use disorder?
Absolutely. Well, our mission is to promote the positive impact of substance use, behavioral health, and co-occurring disorders recovery instead of illness. So we really want to focus on the individuals and families and show them that there is a life after this disease. Our programs and partnerships are often pathways to recovery by removing the social barriers that come with the discussion of this topic, and creating opportunities for those seeking and maintaining their recovery. So our vision is that substance use, mental illness, and co-occurring disorders are recognized as treatable illnesses.
It is, yeah.
Yes, absolutely. And we want to stress that individuals and families in recovery can be seen as acceptable and a sought after thing.
That's good. So it's just like they have to have the willpower to
So that's where it comes down to, is it's an illness in the brain.
It's an illness, yeah.
Willpower has little to do with
Oh,
it.
it does?
It actually has to do with the function of the brain.
Oh, yeah.
So that's one of the big stigmas that we face, is a lot of people think that there's no willpower, when in fact it has nothing to do with willpower.
Oh, I see.
Addiction hijacks the brain to where it bypasses the reasoning stage.
Got it,
Yeah.
So, Ron, as a community outreach specialist, what specific programs or initiatives does the Foundation for Recovery offer to create a sense of community and support among those who have the lived experience?
Yes. Well, community is really built amongst us with shared experiences in recovery from substance use. And that's where peer support really comes in. Peer support is like recovery coaching. It is brought by people who have both lived experience with substance use, mental health challenges, alcohol use, and then have found sustainable recovery. So they've been in recovery for a period of time, and they're able to help somebody who's new or coming back into recovery with support, care, compassion, empathy, you know.
Yeah, they need that, especially empathy during those times, because they're at loss, right? But this one also, you also cover like people who are addicted to gambling, all sorts of addiction, or just substance abuse?
So substance use, mental health challenges, other disorders like gambling use disorder, they are all under behavioral health. So we really are there to help anybody with any kind of, we don't like to use the word addiction anymore.
Yes.
We like to use disorder.
Oh, I see. So because a lot of seniors there have disorder, so I'll call it disorder too, in the casino, going to the casino, especially
Yes.
it's just their neighbor. So I mean, good thing you also address that issue.
Absolutely. Gambling disorder is very big here in Las Vegas. I mean, we have casinos everywhere.
Yeah.
And while,
Big temptation.
Well, big temptation. And while going out and gambling a little bit can be very fun, some people can lose their entire life savings on it. So we
Yeah.
want to be able to help support them and find ways for them to cope without feeling like they need to go gamble.
That's good. But Ron, how does Foundation of Recovery focuses on individual strengths rather than their illness when providing assistance and support?
It's a good question.
Yeah.
So our recovery is a lifelong process, and with that process, there are many good providers here in Las Vegas that help with the clinical side and the treatment side of the disease of substance use and mental health challenges. So where we step in is we really complement the clinical approach by leveraging on their strengths and building a community. We're looking past the diagnosis and basically looking at them as a person first, such as I am a person in long-term recovery. I am a person with HIV, a person with substance use.
Yes, yeah. So you have the lived experience to share with that's good.
Yes.
everything that they need. It's just like you're there and you were able to recover, and you're a good example. I got you. So Ron, could you share a heartwarming success story of someone who has been positively impacted by the services and resources provided by the Foundation for Recovery?
Yes, this is one
For
of
sure,
my,
there's a lot. But
there
could
is.
you
There is.
mention-
There's one that's very near to my heart.
Oh,
I
yes.
still keep in contact with him today.
Mm-hmm.
Originally, I found him when I was at one of my 12-step meetings, and he was out front looking very lost and alone with everything he owned in a backpack. And we started talking. He was homeless, just released from prison and on parole. And one of his conditions was attending 12-step meetings. So we started talking, and I told him what Foundation for Recovery can do. And he started coming to see me. I'm a certified peer recovery support specialist, so he started coming to see me directly. And just through our conversations, some suggestions from myself, some support for him, you know, being there to keep him motivated, keep him engaged. He got himself into detox and then treatment.
Oh, that's good.
Took advantage of the programming in there. They got him into a housing program. In that housing program, he just started working whatever job he could find. And when he started saving enough money, he started looking for a job he wanted to do. Now he works for another treatment center. He is fully self-supporting, giving back to his community and engaging others and sending them to Foundation for Recovery or other community resources.
Wow, that's nice. Yeah. So seniors, I mean, you just have to, I mean, there's help available through the Foundation of Recovery, whether you are substance disorder, gambling disorder. I mean, there's help out there. Yeah. Reach out to Ron. By the way, Ron, you mentioned about the 12-step meeting. So can I ask you about that 12-step meeting that you...
Absolutely. Yeah, so I go to Narcotics Anonymous. That's just the anonymous meeting that I found. There's NA, AA, Al-Anon, a lot of different A groups. And I always say, you know, you need to find the A that's going to save your A. You know?
Yeah.
So I really liked what Narcotics Anonymous had to provide, but at Foundation for Recovery, we really focus on all pathways of recovery because there are so many, and we really want somebody to find the one that engages them the most.
I see. Yeah. That's nice. So you're really like one-on-one with them. It's just one-on-one care with
and
them.
That's the big thing about Foundation for Recovery is there's no, like, we're up here, they're down here. We're not teaching, they're not students. We are right on the same level.
Yeah, that's good to know. Yeah, so it's that. But by the way, going back to that story, it's very nice to know that, because the thing is, when you're in that position, you know you did wrong, you did something wrong, and you can, it's just like, to you, it's like, how am I going to stand up, or how, I mean, maybe the community will not accept me, or, so there's a lot of things going on to your mind, so then you were, good thing you found that person, bless your heart.
I always say that was a God shot.
It is,
you know, and that's the thing of recovery coaching. If somebody's new to recovery or just coming back to recovery, they might need some help and guidance. I don't know anybody personally who has gotten far in their recovery alone.
And besides, you know what, nobody's perfect, but the thing is, that's why I'm putting all this information out there so that people would at least be able to see, or I mean, they would hear from somebody that Foundation for Recovery is available for them.
Thank you.
So, Ron, community involvement is crucial for the success of any nonprofit organization. So how does Foundation for Recovery engage and collaborate with local community to enhance its outreach effort?
That's another very good question. So we work with multiple organizations, coalitions, community advocacy groups, and really work to further educate and engage with the community at large. We at present have a variety of different outreach efforts. You've seen me at many resource fairs.
Yes, yeah.
So I go out to the resource fairs, the health and wellness fairs. We also have some of our volunteer peer support specialists go down to Clark County Detention Center and provide peer support to incarcerated individuals. That way they have a warm place to come to when they get out, instead of, they can make the right turn instead of going left.
I agree. Also, by the way, is that for male and female, for men and women,
Yes.
for both?
Yes.
Yeah, maybe I can volunteer for the women.
You know,
Yeah.
we'd love to have you come, come down and volunteer.
Thank
But that's really the thing, is being able to access these individuals when they're at some of their darkest moments, and let them know there is a way out. Another big thing we do now is we're now hosting monthly health and wellness events at Foundation for Recovery.
Oh, yeah.
It's the third Friday of the month, and our big drive there is to provide direct services. So a lot of times at the resource fairs, you go and get a piece of paper, and information on where to go.
Yes.
At these resource fairs, we are offering direct services such as nutrition education, diabetes education, free phones. The last time we had one, we had massage therapy for free, free yoga class. There's also some vendors there, so you can purchase aromatherapy products, healthy food. There's a local grocer startup that is coming as well, that is connected to a lot of the co-op farms. So that's what we wanted to provide, was direct services, so they don't have to come and then go somewhere else. They can come right to us.
That's good. You are like, what's this, responsive to their needs?
Yes. Yep.
That's good to know. So by the way, what's the schedule every third Wednesday of
It's
what
the
time?
third Friday of
third
every
Friday,
month.
rather Wednesday.
It's okay.
Where did I get that?
The third Friday of every month from 2 to 5 p.m. And there's different people that will be there at every different event. Like this event, our aromatherapy can't make it. She's on vacation in Cancun. But we are also going to have Pearl Vision giving eye vision checks. And we're going to be having a dental van coming soon as well.
That's good.
Yeah.
Yeah, and all those are free, right?
Yes. So we really want to provide as many free resources as we can. Like I said, some people will be selling some stuff there, but a lot of the direct services are free.
Okay. Yeah. So Ron, what challenges do individuals and families typically face when seeking help for mental health and substance use disorders, and how does Foundation for Recovery address these challenges?
So I'm not going to beat around the bush. Nevada ranks either almost last or dead last for access to mental health care here in the country. We have very limited access, but that's where Foundation for Recovery really tries to step up the game by providing all of our services and programs for free. We provide recovery coaching, resource referrals, a variety of mutual aid groups like I mentioned, the 12-step groups, smart recovery groups. We have an organization that comes in to do an art social, a game night. We really want to let them know that recovery is fun. And we have our new Recover You program, which is a 90-day program that really engages somebody and provides some structure. We train Nevada employers on how to implement recovery-friendly practices in their corporate structure so we can change the company culture, lessen the shame and stigma for an employee who may be in crisis, so they can feel that they can talk to human resources or their EAP program. So yeah, we really work hard to bring tangible resources to the community at both at a personal and employment level.
That's good to know. So at least they can be employed after the, wow.
Yes.
Yeah.
Yep.
Yeah, there's hope,
Yeah.
my fellow seniors, or the community of Las Vegas. Reach out to Ron. So peer support plays a vital role in the recovery journey. So how does Foundation for Recovery ensure that its volunteers and staff will, with lived experience, are well equipped to offer effective peer support, just like you, right? You mentioned your experience, yeah.
Thank you. Yeah, so Foundation for Recovery, we offer, we're one of 2 entities in Nevada that can train peer support specialists. There is a 46-hour required training and then 500 hours of peer support application. And so volunteers and our entire staff go through the peer support specialist training. And then they're able to get their hours while they're working in the peer center, working one-on-one. This works towards becoming a certified peer recovery support specialist. Some of our volunteers that go down to CCDC are working on their hours there as well. Our volunteers, employees really draw on the shared experiences that I had mentioned before. Our coworkers are vastly diverse, and so we all have a lot of different experiences. My experience was through homelessness in prison. We have a woman in our office who worked in corporate America and didn't have to lose everything before she found recovery. So she has what we call, more of the high bottom experience. Everybody in our office has their own experience, so we really share and can support each other. So if there is something that comes up that I couldn't have personal experience with, I know somebody in the office who has. So we can really work to provide compassionate service and empathy, above all empathy.
Yeah, empathy above all. Compassion. So, Ron, Nevada is a diverse state with unique regional needs. So how does Foundation for Recovery ensures its services and programs are accessible and relevant across the communities?
It's a great question. And that's the beauty of a recovery community organization like Foundation for Recovery. We call them RCOs for short. The RCOs are organized and responsible to their local recovery community and staffed by people in the community. But we also have advisory boards full of community members. We have our Recovery Friendly Workplace Advisory Board. We have our Cultural Advisory Board. We really work on having community input into our programs and services so we can be engaged in bringing any new changes that the community may be seeking. Because while we have our experience, we don't always know what the community needs.
Yeah,
and so we really engage them through the advisory panels. And I'm always welcome to talk to people if they want to join one of our advisory panels.
Yeah, because it's just like at least you have the skills to apply when you encounter somebody of the whatever disorder they have.
Absolutely, just as there's genuine needs for the homeless community or people who are employed, there's also genuine needs of the senior community that are unique to them, you know?
So, Ron, what are some of the future goals and aspirations for Foundation of Recovery in continuing its mission to support and empower individuals in recovery?
So we're really focused on investing right now in a community space for people in recovery. We're building out our community center and looking to holistically support people who use drugs, people seeking recovery, their families, and all, everybody in the community. We want to have safe spaces that are run by us and can afford opportunities for connection. Connection and community are so important and vital to sustained recovery. We envision having a recovery community centers available all across Nevada. We would love that.
Wow. Yeah. Oh, boy, how come so far? How many communities do you have?
So we have our brick and mortar here in Las Vegas. We have a recovery-friendly workplace ambassador up in Reno, but we don't have a brick and mortar up there yet. But we would love to expand to northern Nevada and just have RCOs throughout, because a lot of rural Nevada does not have support, and that is one thing we would love to be able to bring.
Oh, I see. So Ron, finally, how can individuals who need support or want to get involved with Foundation for Recovery as volunteers or partners reach out and be a part of the community-driven efforts?
So volunteerism is a big factor in running our peer center. Like I mentioned, we have a lot of volunteers providing peer support, but we also need help with our community garden. We have a community garden, so people are able to work in the earth because it's so healing to work with, with plants. So we need help with the community garden. We need help with just maintaining the overall peer center itself. And if you want to volunteer, like if you want to volunteer, or if any of your viewers want to volunteer, I suggest to come down and talk with us and talk to our volunteer coordinator.
Yeah, but not just volunteering, but also donation, correct?
Well, yes, we do
please
accept
reach out to them.
donations. Yes, we do accept donations, cash, always, of course, but we also accept hygiene supplies, blankets, because we have a closet full of stuff to be able to give to people. We have socks in there, hygiene supplies, feminine hygiene products, and blankets, sanitizer, those kinds of things. Another thing I wanted to mention that they can get involved in if anybody is interested, we're going to be throwing a block party, so to speak, called Mobilize Recovery on October 6th. It's going to be inviting the whole community. Anybody who wants to come is able to. They can sign up through Eventbrite, and it's going to be on central Las Vegas, off the strip, at a place called the Industrial, I believe is what it's called.
Yeah. It's on the west side.
Yep. And so we're going to be having that event on October 6th throughout the day, just a celebration of recovery, people out there in the community providing amazing support, just all around celebration.
That's nice to know, yeah.
Can I give the viewers our phone number?
Oh yes, please do.
All right, our phone number is 702-257-8199. Again, that's 702-257-8199.
And your address?
Our address is 4800 Alpine Place. We are upstairs in Suite 12.
And maybe you could want to do the email. How about?
Email is info@forrecovery.org. For Recovery is spelled out, so it's info@forrecovery.org.
Nice. Yeah, thank you very much, Ron.
Thank
We
you.
appreciate you coming.
Thank you.
It's a pleasure.
Yes.
As we come to the end of our time with Ron, Community Outreach Specialist for the Foundation for Recovery, we are truly inspired by the incredible work you are doing to support the individuals and families facing mental health and substance use disorders. We have learned from Ron how the power of hope, support, and understanding can make all the difference in someone's recovery journey. The Foundation for Recovery's tireless efforts to provide a safe and nurturing space for those struggling showcase their commitment to healing and growth. And to our viewers, we hope this episode has shed light on the importance of focusing on strength, not the illness, as we navigate the complexities of mental health and substance use recovery. Remember, you are not alone, and help is always available. Reach out, share your story, and let's build a community of support and understanding together.
Make your realty dream a reality. Discover Nevada real estate. Explore the stunning homes in Las Vegas, Henderson, Summerlin, and other parts of Nevada. Join Maria Garcia, a licensed Las Vegas realtor, as she takes you on a home hunting journey. Finding your dream location is my vocation is her commitment to her work and her clients. With her expertise and dedication, she will help you find your dream home and guide you through the process of making your wish a reality. Explore vibrant communities. Nevada offers a wide range of vibrant communities to suit every lifestyle. From the bustling streets of Las Vegas to the serene neighborhoods of Henderson and the luxury estates of Summerlin, there's something for everyone. Prepare to be amazed by the stunning homes in Nevada that will take your breath away. From sleek modern designs to elegant traditional styles, each home is a masterpiece. Get ready to find your dream home. Contact Maria Garcia at 310-926-4229. Maria Garcia is committed to fairness and equal opportunity in real estate. She is committed in treating every client with respect and professionalism. Maria Garcia is a proud member of the Las Vegas Realtors. This logo represents her dedication to upholding the highest standards of professionalism in the industry. Homes in Las Vegas, Henderson, Summerlin, and other parts of Nevada are not only adorable, but also affordable. Contact Maria Garcia at 310-926-4229, Nevada license number S0190131, your trusted Las Vegas Realtor, and start your home hunting journey today.
Medicare Supplement, also known as Medigap, is an insurance option designed to complement original Medicare. As millions of Americans reach the age of 65 and become eligible for Medicare, they often find gaps in coverage that lead to a substantial out-of-pocket expenses. Medigap plans are specifically designed to fill these gaps, providing beneficiaries with additional coverage and peace of mind. Original Medicare consists of Part A, which is hospital insurance, and Part B, medical insurance, which cover a significant portion of hospital stays, doctor's visit, and other medical services. However, it does not cover all healthcare costs, leaving beneficiaries responsible for deductibles, co-payments, co-insurance, and Medigap plans are offered by private insurance companies and help cover these out-of-pocket costs, allowing seniors to better manage their healthcare expenses. There are 10 standard Medigap plans available, each labeled with the letter A, B, C, D, F, G, K, L, M, and N, and this offering a different level of coverage. Well, for example, Plan F, which was already discontinued last 2020, is one of the most comprehensive plans, covers almost all out-of-pocket costs, while Plan N may require some co-payment and co-insurance. Anyways, I'm going to explain all of this to my next episode because this is quite another topic. So it is important to note that Medigap plans can only be purchased by those enrolled in original Medicare Parts A and Parts B. The beneficiaries must choose a plan that is available in their state. The benefits of Medigap plans are the same regardless of the insurance company. But the premiums may vary, so it's essential to compare options to find the best fit. Well, one crucial aspect of Medigap plans is that they guarantee renewable coverage, meaning as long as your premiums are paid, the policy cannot be canceled by the insurance company regardless of health status. This offers seniors a sense of security, knowing that they will have the consistent access to coverage they need. Well, in summary, Medicare Supplement or Medigap plans are available options for seniors who want to minimize their out-of-pocket expenses and gain added financial protection while enrolled in the original Medicare. These plans provide a range of coverage options, ensuring seniors can select the one that best suits their healthcare needs and budget. As with any insurance decision, it is essential to carefully consider individual circumstances and consult with licensed insurance agent to make an informed choice that aligns with their specific healthcare needs. Enrolling in a Medigap plan is crucial for several reasons, as it offers valuable benefits and financial protection that original Medicare alone does not cover. Well, here are some of the key reasons why people should consider enrolling in a Medigap plan. Filling the gaps. So, original Medicare Parts A and Parts B covers a significant portion of healthcare expenses, but it leaves beneficiaries responsible for deductibles, co-payments, and co-insurance. Medigap plans are designed to fill these gaps, reducing or eliminating out-of-pocket costs, which can be especially important to seniors on fixed income. So, predictable and stable costs. Well, with Medigap plan, beneficiaries can gain a more predictable and stable healthcare cost structure. Since Medigap plans provide additional coverage for co-payments, co-insurance, deductibles, seniors can budget and plan for their healthcare expenses more effectively. Well, freedom to choose healthcare providers. Unlike some other types of Medicare Advantage plan, Medigap plans allow beneficiaries to see any healthcare provider that accepts Medicare. This means you can visit doctors and specialists you prefer without worrying about network restrictions. So, guaranteed renewal coverage. Medigap plans offer guaranteed renewal coverage, which means the insurance company cannot cancel your policy as long as you pay the premium on time. This gives seniors peace of mind knowing that their coverage will remain in place, regardless of any changes in their health circumstances. Coverage for travel. Some Medigap plans offer coverage for emergency medical care during travel outside the United States. This can be especially beneficial for seniors who enjoy traveling or have family abroad. Next, we go simplified billing process. With Medigap plans, beneficiaries receive a separate monthly premium billing from their insurance company. This simplifies the billing process, making it easier to track and manage their health care expenses. Well, flexibility to change plans. Well, beneficiaries have the flexibility to change plans or insurance companies if they find a better option that meets their changing healthcare needs. It is important to note that not everyone may need a Medigap plan. For some individuals, Medicare Advantage plans or other types of insurance coverage may be more suitable. It is essential to assess individuals' healthcare needs and compare the available options to find the best fit. There are proactive measures that can significantly reduce the risk of falls, empowering seniors to maintain their freedom and quality of life. Let's explore some practical strategies to prevent falls and safeguard our seniors' well-being with this video I created on how to prevent fall for seniors. Please watch this short video.
Welcome to Fall Prevention video that highlights key statistics and practical tips for seniors to avoid falls. Falls are a serious concern for seniors. In fact, falls are the leading cause of injury-related deaths among older adults. But the good news is, many falls can be prevented. Let's take a look at some of the most common causes of falls. Tripping hazards, such as clutter or loose rugs, can easily lead to a fall. Poor lighting and slippery surfaces are also major culprits. Regular exercise and balance training are key to preventing falls. Strengthening your muscles and improving your balance can help you stay steady on your feet and reduce your risk of falling. Making simple modifications to your home can greatly reduce your risk of falling. Installing grab bars in the bathroom, removing tripping hazards, and improving lighting are just a few examples. By taking proactive steps, you can reduce your risk of falling and maintain your independence. Wearing proper footwear, getting regular vision checkups, and using assistive devices when needed are all important strategies.
Well, we come to the Medicare Q&A. So the first question at hand is, can you explain the guaranteed issue rights for Medigap plans and when they apply to protect beneficiaries from being denied coverage, higher premiums due to pre-existing conditions? Well, guaranteed rights are an essential aspect of Medicare supplement insurance, or we call it Medigap, that protects beneficiaries from being denied coverage or charge higher premiums due to pre-existing conditions. These rights ensures that Medigap insurance companies must offer you a policy without medical underwriting, regardless of your health status. In other words, this cannot consider your pre-existing condition when determining your eligibility for coverage or the premium cost. Well, there are specific situations when guaranteed issue rights apply. Well, of course, Medigap enrollment period. This is the initial period when you first become eligible for Medicare Part B. It lasts for 6 months starting on the first day of the month in which you turn 65 and enrolled in Part B. During this period, you have the guaranteed issue right to purchase any Medigap policy available in your state without being subject to medical underwriting. So next one is guaranteed issue due to other situations, or you have the guaranteed issue rights. No. There are certain situations that trigger guaranteed issue rights outside the Medigap open enrollment period. This includes losing your health coverage, like employer-sponsored coverage, moving out of your planned service area, or the termination of your current Medigap policy through no fault of your own. In such cases, you have a limited time frame to apply for a new Medigap policy without facing medical underwriting. It is crucial to note that guaranteed issue rights are time sensitive if you miss the eligible periods. You may not be able to secure a Medigap policy without going through a Medicare underwriting. which could result in higher premiums or even denial of coverage based on your health status. Well, additionally, guaranteed issue rights apply only to Medigap plans, not Medicare Advantage plans. If you choose to switch from Medigap plan to Medicare Advantage plan, you may lose your guaranteed issue rights for Medigap and may not be able to return to your previous Medigap plan if you change your mind later. Okay, so we go to the next question. How can beneficiaries compare the costs and benefits of Medigap plans offered in various insurance companies in my state? So, beneficiaries can compare the cost of benefits of different Medigap plans offered by various insurance companies in their state by following these steps. First, research Medigap plans. Start by understanding the 10 standardized Medigap plans: Plan A, Plan B, Plan C, Plan D, Plan F, Plan G, K, L, M, N. So each plan offers a different set of benefits and they are identified by letters. Next, we have the identify insurance companies. Make a list of insurance companies authorized to offer Medigap plans in your state. You can find this information on the official Medicare website or contact your state health insurance program or SHIP for assistance. So next, compare plans benefits. Once you have a list of insurance companies, compare the benefits offered by each Medigap plan they provide. Look for the coverage details such as deductibles, co-payments, co-insurance, and the coverage for Parts A and Parts B excess charges, as well as the additional benefits like foreign travel and emergency coverage. So next one is request plan premiums. Request plan premiums, like contact each insurance company and request information on the monthly premiums for Medigap plans you are interested in. Note that premiums can vary based on factors such as age, location, and the insurance company's pricing method, like community rated, issued age rated, or attained age rated. So next, review financial stability and reputation. Check the financial stability and reputation of each insurance company. Look for reviews, ratings, and customer feedback to gauge their reliability and customer service. Next, use online comparison tools. Utilize online tools and resources to compare Medigap plans and premiums side by side. Several websites and Medicare-specific tools can help you simplify the comparison process. And next, we go to seek professional advice. Well, consult with a licensed insurance agent who specializes in Medicare or Medigap plans. They can provide personalized guidance based on your unique healthcare needs and budget, helping you to find the most suitable plan. Next is consider customer support. Well, evaluate the customer support and assistance offered by each insurance company. A company with excellent customer service can make the enrollment process smoother and offer reliable support in case you need assistance with claims and coverage issues. By following these steps, beneficiaries can effectively compare the costs and benefits of different Medigap plans offered by various insurance companies in your state. This will help you make an informed decision and choose the Medigap plan that best meets your healthcare needs and financial requirements.
Are you passionate about making a difference in lives of seniors? Join our team and be part of something meaningful. We specialize in providing health insurance to seniors and individuals on disabilities. Our mission is to improve lives and ensure access to quality healthcare needs. When you join our team, you open the door to endless opportunities for personal and professional growth, with a possibility of making six-figure income annually. We believe in investing in our employees and helping them reach their full potential. At our organization, we foster a supportive work environment and a collaborative culture. We believe in teamwork and value the contributions of every individual and give all the support necessary for you to achieve your goal. Ready to start your journey with us? Contact Maria Garcia at 310-926-4229 to learn more about the exciting opportunities waiting for you. Your age is not an issue, your compassion is what counts. Call or text Maria Garcia at 310-926-4229 for current job openings and take the first step towards joining our team. Remember, possibilities are endless when you join our team. Welcome to Secure Your Legacy, a compelling information highlighting a final expense insurance plan for all ages, especially for seniors. Our final expense insurance plan offers a no medical coverage for everyone, regardless of illness or past medical history. The premium you pay builds cash value that you can use towards your future premiums. Our quotes includes accidental benefit rider that doubles if death is due to an accident. With our final expense plan, you'll have funeral negotiators who will stand by your side to make all the funeral arrangements. You will receive a 30 to 80% discount on funeral merchandise and a lifetime locked-in benefit for a $2,000 casket cost. The time to secure a final expense plan is today. Contact Maria Garcia at 310-926-4229 to secure the peace of mind you and your family deserve. Don't wait. Get the peace of mind you and your family deserves. Contact Maria Garcia at 310-926-4229 to secure your legacy today. Secure your legacy today with our final expense insurance plan. Contact Maria Garcia at 310-926-4229 for more information.
Well, another hour had passed. I hope you enjoyed today's show as much as I did. I would like to thank my production team for their unwavering support. Well, as we wrap up this episode, let us carry with us the knowledge that mental health and substance use recovery is about embracing the strength within ourselves and those around us. Together, we can break down the stigma surrounding mental health and create a society that values empathy and compassion. Well, I would like to thank you, Ron, for being a beacon of light and hope in the realm of mental health and substance use recovery. We are grateful for your dedication and fostering a supportive community and for reminding us that we are stronger when we stand together. Well, I hope you gained a better understanding of the importance of Medicare supplement insurance and how it can enhance your healthcare coverage. Remember, choosing the right Medigap plan is a personal decision based on your individual needs. Likewise, I hope you gained insights on my Medicare Q&A about Medigap. I would like to send my love, hugs, and kisses to my Medicare clients. And to those who are looking for a reliable agent, I'm looking forward to becoming a part of your Medicare journey. This is Maria Garcia of MariaCares Senior Info Guide. Take care of your health. That's the only one you got. Let's join hands to a better health.